Great. Welcome back to the Healthcare Committee. The good thing about today is we're all getting to exercise because we've been taking lots of breaks, which is good.
Yes.
So, which is a goal of mine.
Yeah.
So if we're not going 2 hours at a segment unless we really have to. So if we need to break, we'll break. So this session for the next hour, probably a little bit less, we are going to work on guiding principles. And I'd like Topper to remind us, because you brought this up, how it worked in House Human Services and just a general idea of what we're trying to get to.
Sure. First of all, let's ask the question, why do we need any kind of guiding principles? This is my opinion only. But that opinion was adopted by the Human Services Committee. And what I feel we need to prevent is, as we develop legislation and then we pass legislation, we want to make sure as we go through that process that we don't make any decisions that are going to affect people in a negative way. That's basically what it is. And if we devise principles that we're going to follow, what happens as you go through? You're never going to get everything right, but you're going to get most of it right. And you're going to feel when you're done that you did everything that you could to make sure that whatever we do here, we're not impacting either the hospitals or the doctors or individuals, the clients, in a negative way. And you feel good about the legislation that you pass. So that's basically why I think we need it.
Thank
And
you.
I'm willing to listen to anybody else, why they might think it might be important, why it isn't important.
Right. And I was just going to suggest that if other people have thoughts, since we've come up with this idea, since Topper brought this to us, not thoughts on what they should be, but just answering the question why. So Topper's viewpoint is that my thoughts in doing this is that there's always something we can look at. So we'll put it up, on the wall and say, okay, if we're having a difficult conversation, if there's a lot of differing opinions, to ground us in a path forward, we are going to have different opinions. And there are going to be decisions we have to make where there might be a population that will, I hate to say this, win with a decision we're making, and a population that may just slightly be increased. And I can give an example to explain that. But that's my purpose of when I thought about us doing this, of why it grounds us in our decision making in this room. Anyone else?
Thank you for starting this, Representative McFawn. And
Let's use first names.
First name-
This is okay, because of just the conversation we're having. I think first names would be
Nobody's
great.
going to know who that is.
Right.
Ms. Topper, going off of what you both said, understanding that we are working with limited resources or finite, maybe that's a better word than limited. And we do have the capacity to potentially raise revenue, yes, but we still have finite resources. So there will always be, at some point, just like what Lori said, we're not going to be able to move legislation in many cases without somebody or some group feeling a negative impact. So I appreciate what you had to say about never harming anyone. We definitely need to use those guidelines. And I think if we are saying we will never hurt anyone, I think we're setting ourselves up there. So it's got to be a little bit more about the reality that we're in.
Thank you. Leslie, sorry.
No worries.
So this is my second term and we didn't have this in my first term and the first term was kind of chaotic. It was Zoom. So I really appreciate having the sort of infrastructure and underpinnings of the work that we're going to do going forward. So I just want to thank you and I think it's going to be really helpful.
Great, thank you. Anyone else before we get started? Okay, so I put this in an email to everyone, which of course I can't find, so I'm going to try and remember what I said. But so we're going to pull up two documents. One's going to be the House Human Services, I'm calling them guiding principles, I don't know what they called them. And then one is going to be the Act 48 principles. So they are different, right? And what we're trying to achieve in this room is not the guiding principles for the healthcare system. It's the guiding principles for our committee that will help us move forward and reach decisions. So Act 48 is really the guiding principles for the healthcare system, although I think we'll be able to pull some things from it or come up with ideas. But so what I'd like to do is thank you, you're so good. Right, so the Act 48 guiding principles were adopted by the General Assembly in 2019 as a framework for reforming healthcare in Vermont. Our goal is to create the guiding principles for our committee, what will guide us as we are making our decisions that affect Vermonters. So with that as the basis, I want to reiterate, we're not wordsmithing here. We are brainstorming. All ideas are good ideas. Please don't talk over anyone, be respectful. And at some point, we're going to get to a place where we say, okay, who wants to volunteer to finish this? Unless we're really incredible and get it done in 50 minutes, which I don't think we will. No. But there's always hope, right? Okay, so let's start with
Is somebody gonna?
Yep, so Leslie, if you can scribe up here, and if you can put up the Human Services ones first, just to give us an idea.
Lori, I forwarded you your message if you want it on your own.
Yes, thank you.
Yeah, I forwarded it, so it should be at the top of your box.
And
Do you want the human services or the
Yes.
guiding? Okay.
these ones. So, we can all read this, but I'm just gonna read through it to try and make more of the point of what we're trying to do. So this is House Human Services, and do you know when this was put in?
About 8 years ago.
About 8 years ago, right?
Whoa.
Yeah. So the rules governing the House of Representatives charge the House Human Services Committee to consider matters relating to human services, public health, and social and economic security. So that is their charge. We will be voting in a resolution on the health care charge, I think tomorrow, you said, right,
Yes.
Leslie? But
Yeah, it's going to be noticed. So it's going to go through, it's going to be the first bill that we see
That
on
we
the
do.
floor.
okay, great.
Yeah.
So in doing so, we are guided by the following: promoting public health for all Vermonters, ensuring that vulnerable Vermonters are safe and protected, ensuring structures are in place to assist Vermonters to move out of poverty, ensuring the issues are addressed through affordable and effective services and supports, and ensuring that all Vermonters have equitable access to services and supports that enable them to attain their highest levels of independence, participate in the community, and realize their potential. That's Human Services. Mari?
Oh, did you want to show the other one first?
Yeah, actually, that would be great. So talk.
Now, when you look at these, they're broad,
Very broad.
very broad. And as Lori said, as you go through each one of, any piece of legislation, let me just give you an example. The Reach Out program, as an example, I hope you all know what that is. Let's say if somebody in a family has a work requirement and they get a job and they're making X amount of money. And they also have a grant. And rather than, for every dollar that they make, you take $1 off their grant. So when you look at that, what is the incentive for that individual family to have somebody work? If you do it slowly, and let's say for the first year, you keep the grant intact, or you have a disregard in there, so if they make $10, they can, in terms of their grant, they can keep 8 of them. So they're not dropped off that cliff. That's what we mean about hurting people. I just use the word hurt because that's how I feel about it.
Yeah.
So it's broad, but as you make those decisions, everybody around the table thinks about it and says, well, that's gonna hurt somebody. Or what about the kids in that family? You know, you think of all, the 11 of us or whatever it is, think of all of those things, the impact of what we're doing has on the family. That's why we kept it broad, so that you could think outside the box and try to be as much as you can, and everything come out in a positive vein, which I already said, it ain't gonna happen all the time.
But we'll do our best.
But it puts you on, like you said, Lori, it puts you on a pathway that keeps you thinking of that all the time.
Yeah.
So,
Great example too. So we're gonna put up the Act 48 principles. I'm not gonna read through them, but we'll put them up so that if people wanna reference them, they can,
Uh-oh.
as soon as she finds them.
I think I deleted.
What I'd like to do, so I think how I want to do this is I'm going to start with one that actually Joe sent. And I apologize. I said I would send them out to everyone and I didn't. I will later. And start with that because I think it's a good one to start with. Leslie can take notes. Mari's also going to type everything. And then we'll just start. I'm going to move a little bit. You guys can stay where you are, but I'm going to move a little bit just to give Leslie some room. And then we can just start throwing out some ideas. So, Joe, if you don't mind, I'm just going to read a paragraph that you sent. So, Joe said, I don't have specific language at this time, but I would like for the mission statement to include language about our work being done through a patient-centric lens. As patients are the ultimate consumer of healthcare, I believe it should be one of our foundational principles that all things must be done with the impacts on patients first. I think we should think about the impact on other stakeholders only through the perspective of how the impact on those other stakeholders impacts the patient experience. So I would say patient-centric. Great. Let's just throw out some ideas and then we can narrow them down. Mari?
I emailed late.
Okay, sorry, I haven't seen it.
There were other principles in Act 48 based on the international human rights principles, and that's universality. There's 5 of them. Universality
What does that mean?
applies to everyone. It makes sure that everyone gets the benefits of whatever we're doing.
Karen, do you need to move some?
So if I wrote, sorry, but benefits are universal, does that say it?
I think it would be better just to, because it ties directly to Act 48, to use the actual language
Which
in
is-
Act
what do
48,
you
so universality.
Okay.
We can define as we go as we need to.
I'm a
Equity.
bad speller, so anyone.
So I'm not doing that.
Yeah, like,
Go ahead, Mari.
Number 2 is equity. Number 3 is accountability, which I think is really important as policymakers, that we follow up on the work that we've accomplished and make sure, and that people that live in Vermont are able to also expect their government officials to be accountable to them.
So if you don't mind, for brainstorming purposes, can you put / oversight?
Yeah, because that's what I was wondering, who's accountable? Yeah.
And these are just the words that, yes, that we can flesh out and apply as we want to. The 4th one is transparency, both in our work and in, I think of some of the regulatory work, for example, that DFR does, making sure that companies, for example, are transparent about their health practices. And then the last one's participation, that people in Vermont have are able to engage in a real way in the creation of healthcare policy in the system that impacts them.
So I'm gonna give a couple examples. I'm gonna change those two a little bit and tell me if you think what I'm about to say makes sense or not. I mean, this is just, I'm throwing it out there. So again, trying to make the principles guiding us and not the healthcare system. I would say participation in this example would mean that we remember, and I'm just saying off the top of my head, we remember that we need to keep all Vermonters in mind and ensure they have ability to participate in our process.
Yep.
We need, not necessarily
The full system.
The full system. So it's just to give an example of how I would change that.
So who's all Vermonters? Because I'm thinking about providers or hospitals and, so is that what you mean?
That's what I mean. Anyone, yep.
So participation at the entire system or what does that mean? I don't know.
Well, and those other things we'll flesh out.
Okay,
So
do you want me to change that?
Nope,
Okay.
that's fine for now. I'm just changing it a little bit from what Lori had said.
And then
But I think you should put it on a comma and then just one liner about it.
All Vermonters.
Yeah.
Or
All
engaging in
participate.
our process. Vermonters
Participating in our
engaging in our process. Basically meaning we are listening to Vermonters.
And then I had 4 more things that I pulled from the the probing questions.
Okay, so hold those. We're gonna let other people talk and we'll come back. That's okay.
Sure.
Oh, I'm sorry, Daisy, did you have
No,
that?
keep going.
Okay, Alyssa and then Brian and then Joe.
Just as I look at principle number 1, the one thing that leaps out to me, and we're dealing with that right now, is the appropriate care. That we have access that is universally accessible, equitable, but that it's the appropriate care. And what are we doing to ensure that people are receiving the right care in the right setting?
Are our
Yes.
decisions.
Our decisions,
Yeah.
ensuring that that's happening.
Yeah.
Because I'm thinking about, right now our decisions that we're making around, mental health and the people sitting in emergency departments. And are we using that principle to ensure that we are making policy and working towards making sure people are in the appropriate setting as opposed to
That makes sense.
harming them by leaving them in settings that is inappropriate?
And we have no input into that decision.
Well, decisions we make.
Let me give you an example. Yeah, the decision we make, we can do that. But the decision to stop the mental health beds in central Vermont was made by UVM Healthcare, period.
Correct, but there are some decisions we can make here that help people getting the appropriate care. But yes, we can't, again, back to the fine point of, right? We don't have control over everything and, money's always involved. Can you just put principle 1 next to that, Leslie, so we remember where it came from? Brian?
I have a point of order before I speak. Are we trying to do this principle by principle, or can I just share my insights?
No, we're not trying to do it principle,
Okay, then
whatever your ideas are.
I just have a list of words.
Okay,
I don't know, I'm trying to not repeat either. So I think accessibility,
okay,
affordability, and sustainability.
hold on.
Yeah. I think that.
We're gonna run out of room, so I think we're just gonna go across.
Yeah, that's fine.
You can, yeah, however it works. I just want to put my words down and then people can, hear that and respond or whatever.
Leslie, write faster.
Efficiency, let's put efficiency down.
Now, it's next.
Accessibility, affordability.
Yeah, this one of my lists.
Sustainability.
That is one, sustainability. And efficiency. And then I think starting a new line for the next ones is important because they're kind of a different category. Grounded in recovery, comma. I feel like I'm doing auto dictation. Empowerment
Excuse me.
and harm reduction. Then another line. I'm almost done too. Flexibility and adaptability would go in this line. And then maybe another line for the next one, and then I'm done. And then I'll just listen for a while. Quality, effectiveness, which might have been referred to a little bit already, but
Don't worry.
but not so specifically. So that's why I wanted to be more specific. These are just some, these are values or things I extracted from all of Act 48.
Yep.
And then I just want to put it out there. I'm not set on how it's woven in, but I think those are just important points that popped out to me.
Okay.
Thank you.
I think she's consolidating just to have space.
Yeah.
Yeah, so when Lori sent this charge out to all of us, I took a little, I sort of built on my own background. So I used to teach ethics. And so one of the work I did was to help students sort of build their own ethical codes and understand how they can be ethical business people. I was doing it in a business school context. And so when I was thinking about this, I was thinking about from the perspective of, ethically, what do I think that we have to do when it comes to healthcare? And so I did a little research on the principles of medical ethics. And I found in some Googling and some research that there are basically 4 generally accepted principles of medical ethics. And I just want to highlight those for our conversation. The first principle is autonomy. And the idea, and I sort of had a little brainstorm about what do I think these mean for our committee. To me, I think that means being committed to preserving a patient's right to self-determination, protecting the doctor-patient relationship, and having basically protecting that relationship to make medical decisions without interference from insurance companies. The other one, second principle is the principle of non-malfeasance. Which means the principle of not doing harm, first do no harm. And that was important to me because, as Topper was saying, we have to make sure we're not hurting others. And so I thought the idea of non-malfeasance is a good ethical value to have for a committee such as ours.
So just so you know, we're changing that to do no harm.
Okay, that's fine, yep.
And everyone can, I can say this is the Hippocratic Oath, right?
Yeah.
Come on, spell malfeasance.
I've got to start.
The third one is the principle of beneficence, or doing good, which is ensuring that whenever you act in a healthcare aspect, not only are you not doing harm, but you're also doing good. And then the fourth one is the principle of justice. And to me, that was ensuring equity and fairness for all patients or a decision, no matter who they are, and regardless of their ability to pay. And so those just stood out to me because they felt like ethically and value-centered words that are ethical principles that I know I'm going to be thinking of throughout this process, and I just wanted to throw them out there.
And Joe, if you wouldn't mind, can you send the email you sent me to everyone, just so that they have that in writing in their emails? That'd be great. Anyone else before I go back to Mari? Daisy?
I've been trying to hold back from throwing out buzzwords, but knowing that this will sort of go into some sort of soup that people will make a little more coherent and hopefully productive, I will probably throw out some buzzwords, but coordinated, collaborative, and maybe you all can help me articulate this, but representative. So for example, I have constituents who will not go seek mental health care because they don't want to talk through a translator to the only counselor available. So I really desire that we have the available clinicians who can speak in the language and also the culture of the people that they serve. So I don't know if representative is the right word, but
Or something with,
Culture.
I was gonna say something with.
culturally appropriate.
Yeah, at least for now.
Or, yeah, not appropriate, because that's the culturally responsive.
There you go. Can we say cultural humility, which is the term being used now in the trainings around a system grounded in cultural humility? we used to say cultural competence, but now that's like the new word. I'm not set on it, I'm just throwing it out.
I have no
Are you
idea.
okay with that?
Could we say cultural competence?
Cultural awareness.
That's a good one too.
What
You
does
see all-
SAMHSA say these days?
I can look it up, but we could just as a placeholder.
Oh, placeholder.
Awareness, humility and competence and just leave it at that and then I'll look it up.
I would just do cultural awareness for now. We know what Daisy's trying to get at.
Yeah.
It can be words.
And I'll look it up.
It's really aspirational, so, you know, because you may not have a person who can speak whatever language
I think
we did or translate, I don't know, that's hard.
I think it has to be stronger than awareness.
How about this one? Culturally adapted evidence-based treatments. That came from the SAMHSA website.
So let's keep
We
this.
can work on it
Yeah.
later, but I think it's gotta be something stronger than awareness.
Culturally
Sorry. The
responsive.
thing, let's not try to make it perfect.
Exactly.
Yeah.
It's a placeholder and Ledge Council can maybe help us like look up this language too.
All right. Anyone who has not spoken, any ideas? Art?
I just throw out what I had
Yep.
first, and to me, it covers most of this. Ensure that Vermonters have access to and receive excellent health care. It's just an overall arching thing. Excellent health care means that it's appropriate, it's cultural, it's coordinated. If it's excellent, it's all those things. Just a thought.
Okay, that's great.
So I spent some considerable time and I came at it from the wrong angle the first time.
But what you sent was amazing. I'm gonna send it to everyone if you don't mind.
Yeah, it's fine. But then I came at it from another angle. And I did what Art did. I said, you know, access to high quality medically necessary health services that is accessible and affordable. So that was like sort of I think that's our job, right? To make sure, I was trying to figure out the job of the committee. I was trying to figure out the job of the committee in terms of workforce, that it's trained, supported, retained to meet the ongoing needs of our population. So there was a workforce piece for me. So I'm just right, workforce.
Yeah, go for
Because
it.
a lot of this is about from the patient perspective, and I, as a clinician, came at it from a clinician kind of point of view.
And I also I'm gonna put all that up there because it's great. I also wanna say, we know what our job is. What are the principles that are gonna guide us as we do our job? Is what we're trying to focus on here.
Because we hear a lot about workforce and then we say, well, we don't have a workforce and people are in the ER and we're mad at everyone, but we don't have a workforce.
Right.
Well, and I think you're right in that. That's one of the ones I had. I had
Yeah.
like 6 of them here.
Yeah.
And the one I gave was the first one,
Yeah.
but I get more specific in mine because I don't know how we do this without thinking about workforce.
I also talked about ensuring that Vermont's health delivery system sees continuous improvement of healthcare quality and safety. That needs to be embedded in our workforce, that it is, the triple aim, you mentioned the quadruple aim, I think that's really important. I think that if Vermonters should be protected from medical debt, I think that should be our responsibility. I don't know if that's guiding principle. I mean, it may be too, drilled down too much, but I hate medical debt. I hate that anyone is affected by that.
And so I would, part of that is affordability,
Yeah,
And do no harm.
no harm.
I guess so. I mean, but maybe it's more of a tactic than a principle, whatever. What else? I think that's it.
Okay.
Oh, no, one more. That there's continuous improvement of the health of the population and healthy lifestyles are promoted. So a focus on population health. We should.
Put them up. Art,
That's a result.
absolutely. Art, did you have any more that you wanted?
Well, I have several more, but I don't want
Okay.
to monopolize. But one thing I had on here, and I think it's important, I think we should start doing it. I think all the departments we deal with need to be charged all the time with looking at ways they can change their methods, procedures, and everything to make healthcare less expensive. I think we need a concerted effort to look at, and hate to say this, but where there's fat, where there's extra, where there's a procedure that can change. For a long time, I thought about administrative work being subbed out to a subcontractor. Stuff like that. Can it be done? Maybe it can't, but I think we need to think outside the box if we're gonna cut down the cost of healthcare.
And I think that goes back to affordability,
Yeah.
right? And sustainability.
Affordability and accountability, because I really do think we need to direct some things.
Yep, and that's up there.
So, I think there's some themes that we all have. I think-
Oh, wait, hold on, we're not done yet.
Oh, sorry. I'm just gonna underline.
Yep, go for it.
That's the same.
I think there's some more that wanna come up. I'm gonna come back. Actually, did you have anything you wanna add right now? I don't wanna put you on the spot if you don't.
Well, I was
Or
gonna
Alan?
do, but the Hippocratic Oath thing that
Okay,
Joan already did, so you kind of beat me to it, so, but that was, the do no harm,
Yep.
like that as a principle.
perfect. Alan, anything to add
Proper
at this
safety.
point? Nope, okay. Then I'm going back to Mari and then Daisy and then Brian.
I guess my question would be, how do we accomplish all that?
Right, well, again.
These are just guidelines.
Guide us.
If you come up with that, Alan, you're worth
Right,
a lot.
Topper, were you gonna say something?
Yeah, I was gonna say, if these are guiding principles, it's, in my opinion, and again, I'm gonna say it's only my opinion, if they're guiding principles, we can do it. I think what you're talking about is money.
It comes into the play.
Yeah.
Yeah, it will, but if the guiding principle, we're going down this path and there's rails on each side, and that's what we're making sure we don't jump over it. We stay in there. That's what'll, we'll get the cost and all that later on.
Yeah.
These are the things that are just gonna guide us as we develop legislation.
And as we have a topic where there's 5 different opinions, right? So we came up with what's gonna guide us. We're gonna look at those opinions with that in mind. Mari,
So everyone has already touched on some of these in a different way, but again, this is coming from the probing questions document. One is value collective humanity, which to me would fit with do no harm, be respectful. But I liked the phrase value collective humanity. And then adding to do no harm is repair harm, to think about how there's harm is already been experienced in our work. Is there a way that we can repair any past harm? Increase the well-being of all, we don't need to add that. And then I think that process is so important and in our work, and that we are mindful. These are not the words I need you to write down, Leslie. We need to be mindful about our process. Yes, we have a short amount of time to work on things, but we also need to try to not rush through things. So
I think a deliberative process.
yeah, strong and inclusive deliberative process. And the key word is inclusive.
Leslie, a second, and then we'll go to Daisy.
Oh, so I'm just gonna say deliberative process, inclusive, and is there another word you want?
Just strong and deliberative inclusive process.
Well, it's sort of out of order, so.
That's fine.
Yeah.
Daisy.
I'm just contemplating that many of these are sort of looking through the lens of Act 48 and how we're going to support the implementation of that and healthcare reform itself, but also sort of looking outward at, other elements of our system. Like I haven't, admittedly absorbed Act 48 enough to say whether it really speaks to how we might be touching on the social determinants of health and considering those as we make decisions in here. So I think I'd like to mention something around keeping that lens on, as well as, looking to the future and healthcare modernization and the tools that we use and the way that we address workforce issues and supporting the workforce.
The social determinants of health.
Do you feel like that if I put that continuous improvement in population and include social determinants of health in that idea?
Population health. Yeah, I think as long as that's up there,
Yeah, I mean,
our wordsmiths will.
Yeah, the
so you can fix that, that's the
Yep.
idea. Because that's more about population health when you think about it. I mean, it drills down. Okay.
What else, Daisy? What else?
I'm happy.
You happy? Okay, Brian?
Yeah, so I wanted to say more about, from the perspective of being a provider, and I'm just gonna say it because then we can extract something from it. It's not like a list of words. That something I've noticed is that the way we're treated as healthcare providers is extractive. Like we're expected to like sacrifice our own health for the health of others. And we've done this, some of us for a real, like Myanmar, for example, like a really long time. And it's caused a lot of harm to us. And I see burned out providers who are unaware of the harm that's been caused to them. They don't see how their burnout is hurting their patients in the way that they treat them. And it's systematized by certain policies, like the way people are trained or like the way that, like staffing ratios occur, et cetera. We can go on and on. But the point is that it creates this extractive environment. And I think we need to look at how to transition from that to a regenerative culture in healthcare for everyone, where the idea is that we honor that it's humans helping humans, that we're not machines. And so we need to create like workplaces and working conditions that regenerate the workers so that they can better serve the people. Because right now what happens is we suck people dry and then we cast them aside. And that's why no one wants to do these jobs anymore, even when we're throwing money at them. So I just want to put that out there. And maybe the way to summarize it is,
Does that work?
yeah, and maybe just like transition from extractive to regenerative culture or something like that would capture, and we don't have to use that exact language, but that kind of captures the point I'm trying to make.
I do want to make sure we use language that is accessible to everyone so that people understand what we're trying to do. And I appreciate you bringing up that because I don't think we have that on here yet. Topper.
Yeah.
I want to throw something out that I'm hoping it brings the right reaction. Individuals, and we'll word this somehow so that we can all take a look at it. Individuals have the responsibility for their own health care. And individuals, I think everybody, based on their ability, should have some stake in paying for whatever we do.
Pain or paying?
Paying.
Okay, all right. Whoa.
Paying. Money.
Hey.
Yeah, I hear you.
Based on their ability. I think it's important that we keep that in mind when we're doing this, because this is a huge amount of money and grief and anxiety among families or individuals when they get the bill. And sometimes they can pay some of it, sometimes they can't. So I just throw that out
Yeah.
because I think it should be part of the
So
what we keep
population
in
should
mind.
participate in the financial, that's what I'm trying to think about.
Yeah, that's about what I'm saying.
Okay.
Responsibility for their keeping themselves healthy.
Population should participate in their own healthcare. How's that for now? Does that help?
Yeah, sure. I can write between the
Yeah,
lines. quick.
exactly. We'll make sure it's wordsmith.
So it would also be, I don't want to say
Responsibility.
habit. Well, I was also gonna say, like, there's the financial aspect, but there's also the habits aspect, how they live their life
Yeah.
choices. But sometimes there's no agency, you get people who just can't.
Yeah.
So
Right.
how do we, sort of work on that?
So I think we know kind of what that we're trying to get to again.
I'll say lifestyle, just for
There you
want of another term.
Hold on.
Feel uncomfortable with that one.
Okay, that's okay. This is brainstorming, right? So every idea is gonna get on the board and then we're gonna work on them. But we will notate your,
You're gonna have another shot at it.
So noted.
okay, we're going with Art and then Joe, I think that was it.
Yeah, I kind of want to expound on what Brian just said in a different way. We need to keep our providers in mind all the time. They may be on here already, I don't know. But not only in their health and burnout, which is very important, I think, but also to make sure we structure things so we attract and can keep providers that we have. And I think that's a huge issue as we look at fee for service versus something else. And so I think retention of providers is an issue that's important. Now, I know we're starting to get into the weeds.
Right.
And I know that, but.
But it's good to state so that when.
Yeah, I mean,
together, then-
it's hard to do this without getting into the weeds.
I know, it is, very hard.
There's many things that
Right.
we just have to consider.
That's why I think I said earlier, this for me is probably one of the hardest things we're going to do this year. Yes.
The mission
You
statement.
know, brainstorming and wordsmithing. I don't like wordsmithing, so I'm not gonna be on that committee.
Retain and sustain, or
Exactly.
retain and sustain.
Yeah, that's fine.
Joe,
So I found the word participate interesting because I felt when you were approaching participate, you're approaching it from sort of a healthy lifestyles approach. But another aspect of participating in your healthcare is advocating for yourself. And being able to articulate to your doctor what you need, and being, when you don't get what you need, to still advocate for your needs and try to get what you need. And that is such a challenge for patients, I think, often. And so I think that if, when we're talking about participation, I think we also have to think about how we support patients in being able to participate so they can, if a doctor makes a decision they don't agree with, or if something's not occurring because of an insurance holdup or something like that, they have the tools in their toolbox to be able to say, no, this is why I need this, and to advocate it before a doctor, because it can be so intimidating to walk into a doctor's office and to have your symptoms dismissed. And I speak from personal experience there of having a doctor tell me that my symptoms weren't possible, which was not true. And I went to other doctors who recognized my symptoms for what they were. But, it's very easy to be shut down when a doctor in a white lab coat tells you, that's not possible. That's not how it works. And so how do we support patients in their participation in the healthcare system?
I think that's such a good point and a really good point for us to remember. One of your phrases was, not everyone can advocate for themselves. That's so important.
So that's what I wrote, yeah, support for those that can't.
So I know we're gonna do this in order, right? But I got you and then Brian and then Mari and then Daisy. So remember what you were gonna say, Daisy.
I was telling Joe, that's why collaborative coordinated care,
Okay.
that model gets at that.
Listen,
No, I just thought I would share Act 48's principle number 7, which I think is getting to exactly what we're talking about here. It's individuals have a personal responsibility to maintain their own health and to use health resources wisely, and all individuals should have a financial stake in the health services that they receive.
Yep.
And I think, that is a guiding principle. I think to your point, Joe, we should keep in mind that we should not be making policy that makes it more difficult for people to take personal responsibility. Because we do that sometimes.
If I could comment on that, I'm sorry, but I'm standing here.
so I'm gonna say no, only because I'm making everyone go in order who also had probably something to say from 5 minutes ago. So you're next. You're in line.
I'm after Daisy.
So remember,
Yeah.
Brian, and then Joe.
I just wanted to point out that some of what we're talking about relates to the social determinant of health called structural conflict. And structural conflict is when people experience distress from conflicts that arise from their interactions with the social structures around them. And so in the healthcare system, we see a lot of structural conflict, the providers are under stress trying to engage this complicated bureaucratic system, or patients trying to navigate all these barriers, and that stress is actually like has a negative impact on health for everybody. So if we could address structural conflict in the healthcare system, it could be just as significant as increasing access to the healthcare itself. And we could amplify the investments of the state because we're spending all this money on something that's actually causing harm through structural conflict. But if we think about that in the design of the structures, then the money we spend on those structures not only are providing the healthcare, but they're reducing something that's causing people to need healthcare, if that makes sense. And so I just want to put it out there that structural conflict is something we should keep in mind, and participatory decision-making, which we've alluded to here, would actually be a huge step forward in addressing structural conflict. Also, more training for providers in like nonviolent communication and like conflict resolution and approaches to managing conflict, besides just invoking their power as a healthcare provider, or on the other side, de-escalating a patient who then hits the healthcare provider, because there's a lot of injuries happening to us right now. So I'm just putting it out there that there's a lot of conflict you see. If you go to the emergency, if you could just watch what happens in the emergency room, you would see like, it's like a war zone with the amount of conflict that's playing out because people aren't getting their needs met. And not everyone can advocate for their needs, but then there's other people who aggressively advocate for their needs at the expense of other patients. Like they will be screaming and fighting and someone else is being neglected because it's like 7 staff are trying to manage one person. So I'm just putting it out there.
Thank you.
Yeah.
No, that's great.
Yeah.
And I into what you deal with. Mari?
Yeah.
Population participating in their own healthcare, the personal responsibility part, financial,
They say use health resources wisely.
but you have a
And that
financial skin
individuals
in the
have a
game.
financial stake in the services they receive.
I have a strong reaction to that. I don't think that, I think that at the point of access, there should be no financial obstacle, no financial, requirement at the point of care. That,
So, right?
let me just
Yeah, hold on, listen.
there is also in the personal responsibility thing, who are we to be the arbiters of someone's personal situation? There's significant amount of shame, bias. I'm not going to be telling someone how they should be responsible for their own care. And I'm going to use myself as an example. Obesity is a really, really misunderstood condition that has a lot of shame around it. I'm not feeling shameful myself right now. I'm an advocate. But in the healthcare system, there is already a lot of misunderstanding. People don't get appropriate care because for every condition you walk in with, because of this bias, providers assume it's because you're fat. It's not true. So we can't know the personal situation, healthcare situation for every single person that is involved in their healthcare issue. So I just think that we need to not go down that road because of bias, shame. I think those are obstacles to people accessing care and being able to help themselves. So I like the approach of the advocacy part and empowering people in the doctor's office to speak up for themselves and know that they're, educate providers about these issues. But not attach shame and sort of we know better about other people's personal health decisions and issues.
So I think, I think this is a really good example of why we're doing this, because there's some disagreement on some of these words we're using, right? And so that's the whole purpose of doing this, so that we can have a conversation and get to collaboration. I will also remind us, this is guidelines, principles for our committee, not for the healthcare system, right? So when the wordsmithing group goes out, keep that in mind when you're looking at those. So, but thank you, Mari. And if you, Leslie, can you just put, number 7 next to the one we're talking about so that we know it's Act 48, principle number 7. Daisy.
No comment.
You done?
Yep.
Okay. Oh, wait, you were talking to Joe. Leslie.
I really am interested in what Mari's saying, because I have Medicare. I don't have to pay anything, ever, because I'm lucky and privileged and whatever. So I don't think we should force people to have a financial stake, because then it's going to change how they behave, and it'll make them avoid care, and that's not what we want.
And so again, I think.
So I'm just saying.
Yeah, and I appreciate that. I think we're getting along the lines of like what our expectations are for the healthcare system, not what our expectations are that are going to guide us in our decision making. Joe.
So I just wanted to come back to Alyssa's point from a couple of minutes ago about, I think it was Principle 7, and the idea of, making sure that we don't do anything to harm, a patient's ability to advocate for themselves, which I agree with. But I also think it's a really excellent example of why I think both non-malfeasance and beneficence have to go together, the do no harm and doing good. Because, on one hand, you have the let's make sure nothing we do will ever make it harder for a patient to advocate for themselves. But I think at the same time, we should have a positive moral responsibility to also make it easier for people to advocate for themselves. And so, the non-malfeasance, I think, is a check on us to say, are we doing bad? And that should never happen. But then the doing good aspect, the beneficence, calls up upon us to say that it's not enough to ask ourselves, are we simply doing no harm? We must ask ourselves, are we also doing good at the same time? And what can we do to cause there to be more good in the healthcare system, because so many suffer?
Yeah, that's right. We're going to wrap up here in a minute and decide next steps, because I want to be cognizant of the time. But as we're talking about some of these points, one of the things that comes to my mind as an example, and maybe it doesn't work for everyone else, but when we were going through COVID and we were putting a lot of things in place, the health department was putting notices out, what everyone should do to stay healthy. There was an outbreak in one of our communities among a population that couldn't read those notices.
Right.
So if we come up with a guiding principle around that concept, then I would think when we're in committee, our thought process would be, okay, and we did it in another bill too, where we said, who I forget it was, Green Mountain Care Board. We put in legislation, their reports have to be X, Y, and Z. We don't want to get too prescriptive in legislation, but the concept is to guide us is we need to make sure that everyone can understand what we're doing here, whether it be, some type of advocacy bill, or making sure the everything that's being put out is in multiple languages. So I'm trying to, I don't know if I'm doing it or not.
I think cultural awareness, I'd circle that.
Yep. So I'm just trying to do the example of this is our guiding principle, and then this is the practice in our committee. So I don't know if that helped or not. Bobby, and then we'll wrap up.
Well, there's one word that I guess this hasn't come up,
Okay.
and I think it belongs in here, is the word protective, for both patient and provider. Thinking what Brian was saying about the dangers of being a provider, and thinking about actively putting that out there. We're patient-centric, but we're also provider protective, in that we're shielding them from harm, both economic and physical. So.
Good point. Yep. All right. And then you're the last one.
Yeah, and it's not a big speech this time. It's just when Mari was speaking, I felt like you were speaking to stigma when you were talking about how people living with obesity are treated. Like they're so stigmatized in the healthcare and shamed. And that's the same for mental health conditions, and especially for substance use disorders. Like it's so bad. What I hear, how people are spoken about, when they have a substance use disorder. So I just think being mindful of stigma, and that's it.
Great.
And I'll stop there.
And I think that's a great one to put up there. That when we are using the language in committee, as well as language in our legislation or reports, that we're cognizant of language that may lead to someone or a population being stigmatized. So thank you. Thank you. Okay. So we have
This
some
is
ideas.
wonderful, right? How cool is this?
This is great.
Yeah.
Now who's gonna volunteer? All right, we need less than a quorum, so no more than 5. I would suggest 3 or 4. We have Joe, we have Topper, we have Leslie.
Great.
Awesome. And then, so I would say if the 3 of you can meet, I'm not gonna give you a timeline. I think you'll, work on it, get us a draft, 4 or 5 principles. Remember, you can go back and watch YouTube if you don't remember what we talked about on all of these.
Take a picture of
I'm
it.
gonna take a
And
picture.
Claire took notes,
Yeah.
right? And Joe's taking a picture.
Yeah.
It'll last
So-
longer.
And Claire has everything written down. So
We'll do that.
That's perfect.
Claire, if you can send that to everyone, yep.
So yes, we just want a leader to set the agenda, meeting times, just if that's something.
I will let Topper take charge of that. And I think this was great. Topper, thank you for the idea. It went a lot better than I thought it would. I don't know. I'm so bad at this stuff. But I think this was great ideas, good conversation. I think it also helped get out some of what we're all feeling about the healthcare system and our own individual beliefs on where it should move. We're not going to agree on everything, and that's okay. That's what makes better legislation. So we'll be back at 1:00 for something.
Is that the healthcare advocate?
Yes, we'll be back at 1:00 for the healthcare advocate.
Speaking of advocacy,
Hey,
And I'm sending this out to the whole committee.
perfect. Oh, you took notes too? Great.
Yeah.
So send them both.
this timeliness.
Have a great